So for those of you that don't know me, I'm Dr. Stephanie Canestraro. I founded the Vegas Clinic because of my own problems with anxiety that came about after a tentative diagnosis of multiple sclerosis. Retrospectively, it ended up being Lyme disease and also parasites, but it was almost textbook neuroborreliosis, which is when Lyme crosses the blood-brain barrier. I've used my own health journey to help uncover roadblocks for my patients, and I named my clinic after the vagus nerve because of how mine felt so hijacked at the time when I was going through a lot of my struggles, which I still do go through some struggles. I work with professional athletes in my manual practice, mainly NHL. And I also work with people like you and me with Lyme disease, but also for high performing athletes to perform better. And, they all have the same exposures that we do, and we're going to talk about that. So, first, I'm talking about the vagus nerve because it's an important part of healing. So the vagus nerve is the 10th cranial nerve. So we have 12 cranial nerves that exit so they either come off the brain or the brain stem, and they exit different foramen, which are little holes in the skull, and enter to go to innervate whatever they innervate. So the vagus nerve is known as the wandering nerve because it's the longest cranial nerve, and it's also the primary driver of our parasympathetic nervous system. So for people that don't know what that is, the parasympathetic nervous system is responsible for rest and digest side of our automatic nervous system, which the opposite of the parasympathetic is the sympathetic state, which is the fight or flight response, which most of us are living in our fight or flight response. It's a very stressful world. We haven't really learned how to reconnect in a lot of ways that are beneficial to our health. And we're going to go over some of those ways. But the vagus nerve is an information highway between your gut and your brain. So our gut is innervated by something called the enteric nervous system. And the enteric nervous system actually has more nerve endings than our whole entire spinal cord. So you can kind of see it over here. And this is it just showing the nerves in your body. But it takes 80% of the information from our gut, which is considered still an external part of the world, to assess what's going on. And then it brings information up to the brain. And then the brain creates different actions based on that information. So it is very, very, very important nerve for that aspect. After feeling a big stressful response, the vagus nerve initiates relaxation. It helps with the formation of memories. So you can think at times when you're really stressed, you can't remember words or you can't remember things. And even with things like Lyme disease and other diseases, there's that loss of memory, right? You can't form those memories or access them as quickly. Vagus nerve helps you breathe, controls your heart rate. So it's actually mostly responsible for the exhale. So that's why exhaling longer helps to activate the vagus nerve, but we're going to get into that. And when you stimulate the vagus nerve, especially when it's been inhibited because of too much sympathetic or too much fight or flight, too much stress, too much trauma, if you stimulate it manually or find a way to turn it back on, which we're going to talk about those ways, you can significantly reduce inflammation. So we have two branches of our vagus nerve, the right side and the left side. So, and from those right and left sides, there's also anterior and posterior. So front and back, where they exit off, or they originate at two different places, different nerve roots or ganglia, they're called. But without getting too much into that, we can just see the intricacies in this photo of the vagus nerve just wrapping around even our aorta down to our heart. So you can see like the yellow just wrapping and innervating around there. So it's like very intricately connected, and it innervates all the way down to our colon, but not the entire colon. The lower part of the colon, so the descending part of the colon and the rectum are innervated by S1 and S2 nerve roots in around our SI joint or our sacrum. So that's the other part where our body creates this parasympathetic response for our organs that are innervated by that section. So you can see that it's a pretty extensive nerve innervating, touching almost every organ. They say except for the adrenal glands. So vagal tone is a measure of your vagus nerve activity. So lots of people are getting much more familiar with this. We've been using this since 2015. But it's often used as an indicator of physical health. So good heart rate variability, which is the way that we can measure the vagus nerve, which is the difference in between beats. We're not supposed to have just the same beat or the same rhythm. There's changes. If I know some people can't see my hands, but just different wavelengths. So just like a muscle, vagal tone can be strengthened through regular stimulation. There are certain flags of if you have low vagal tone, and that is abdominal pain can be one of them, brain fog, unusual heart rate or blood pressure, low heart rate variability if you're wearing anything that measures variability, nausea or vomiting, ear pain, loss of gag reflex, constipation because it's in charge of our migrating motor complex. And that's what helps us eliminate stool from our body and keep food moving in a downward motion. So when you have low vagal tone, you can be pretty bloated, you can get constipated, but you can also fluctuate between constipation and diarrhea. Low stomach acid because it's in charge of making that rich stomach acid. Stomach acid is something that takes a lot of energy to make. When you're actually in a stressed state, you make a lot more cheaper acid. So our stomach is meant to be a very low pH when we're eating. It goes down to a pH of 2. So when you're eating in a stressed state, it's very hard for your stomach to get that really strong hydrochloric acid in your stomach that's going to sterilize your food, help to break down things that are hard to digest. And it starts the whole digestive signaling pathway. Well, it starts once you smell the food and start eating, but when your stomach acid hits your small intestine is not equipped to handle that much acidity. So it triggers this switch that causes a release of bile and bile acids and bicarbonate. So our body makes baking soda in our pancreas liver, and it gets released into the small intestine. So if you don't have a strong stomach acid, like you're in a stressed state when you're eating and your body makes a acid with a pH of 5, well, that's not enough to trigger these good responses. And your vagus nerve is part of what allows you to make that strong stomach acid. And it's also in charge of contracting your gallbladder if you have one still, but that release of bile. So it's really, really, really a huge part of digestion. So another flag of not low vagal tone, but if your uvula deviates, it will direct to the injury of the vagus nerve. So even if you have manual compression or structural compression, like tight muscles, or if you know your neck's kinked or something, it can put direct pressure on the vagus nerve, and you can get neurological symptoms like your uvula, the little hanging thing at the back of your throat, will point to the wrong direction, or it should just go up and back. But if it points one way or the other, then that means the side that it points to is the injured side of the vagus nerve. Chronic pain is a huge one because it does lower inflammation to have good vagal nerve tone, ringing in ears. So tinnitus is a big one. So over here, you'll see a picture of different stressors, right? That we have different dietary stressors. So food allergies we don't even know about, or just a poor diet in general, or lots of omega-6 fatty acids. Environment, well, I could go on for days about because there's so much chemicals and that we're exposed to. There's so much EMF, there's a lot. So financial stressors, everyone's, had that at some point in time, or genetics. So sometimes we have poor detox, or, we don't make certain neurotransmitters or whatever it is. Infections are huge for me for poor vagal tone, but really, like, whatever your toxic load, the higher your toxic load is, the lower the vagal tone is what we see. Metals are huge, relationships and traumas. So you can see these little circles that are attaching to it. Chronic Lyme disease adds to poor vagal tone. All these stressors can lead to fibromyalgia. They can lead to central nervous system sensitivity syndromes, chronic fatigue, multiple chemical sensitivity syndromes. So yeah, if we can get it activated, we can really help. But also changes in your voice, because it does innervate part of the larynx. So ways to measure your vagal tone. Heart math is the big one that we used for years. It just clips onto your ear, so it just takes a reading in the short while. Because if you follow anything that I do, I don't really love EMF. And so these wearables, the Oura Ring's a bit better because it'll take a reading and then shut off. It won't be putting any electromagnetic frequencies constantly through your body. But in the Oura Ring, it's called the readiness score. In heart math, it's called coherence. So you get a coherence score, and you can use your breath and stuff to regulate your heart rate variability. Apple Watch, I do not recommend, because it is just radiating you. I mean, I couldn't even wear mine. I had aching. The Vagus ECG watch is really good. It just measures for a few minutes, and it actually coaches you through it, and you actually get feedback from the guy who created it. So, yeah, those are some ways to read vagal tone, but there's also machines, if you go and see practitioners, that they'll put electrodes on your wrists and ankles and have you sit there quietly, and it can read sympathetic compared to parasympathetic based on your heart rate. And you can get a lot of information that way. And you'll see, as you lower someone's toxic load, then their heart rate variability gets better, and that therefore their vagus nerve is more active. I just mentioned this, but high toxicity equals a low vagal tone. So it's what I just mentioned before, but let's go over it again. Lyme disease and other stealth infections, co-infections. So Lyme is from a specific bacteria called Borrelia burgdorferi. And it is a spiral-shaped bacteria, but it also comes along with these co-infections. They never used to really exist together, but they really do complicate the disease. But examples of co-infections are Babesia, Bartonella. Babesia is a parasite. Bartonella is another bacteria. Anaplasma, Ehrlichia. There's a whole plethora of them. And then there's opportunistic infections. Those are ones like Epstein-Barr virus, cytomegalovirus, all the different herpes class viruses, HSV1, HSV2, HHV6, HHV7, and even streptococcus is considered an opportunistic infection. And all of these infections can go into like a stealth mode, or it's called pleomorphism. So they can exist in multiple different forms, and some of their forms are more active and inflammatory for our body, and some are not. And they can cycle through these forms, and that can be why people feel symptoms and then they don't feel symptoms, including like times of high stress. The immune system can go down. You can start to get symptoms of low vagal tone, or that hijacked feeling, that panic mode, or that rumination mode, or that spiraling that maybe, was sort of in remission without even you doing anything. And depending what's going on in the body, they can ebb and flow. And then just other viruses, parasites, and bacteria. There are multiple. So no one exists without viruses, parasites, or bacteria. But it is just, what is your immune system? How is the rest of the toxic load that are feeding these? Because if it gets imbalanced, that's when we start to have problems. And if we can't keep inflammation down, and we can't keep the vagus nerve active, which is harder and harder these days, then you're going to see a lot more symptoms. And that's what's happened with me. And I see it with multiple patients, and I see it with even my healthy athletes. Mold I didn't mention yet, but that's huge. Mold and the mycotoxins from mold. Either molds can be actually colonized in your body, so living there, or you can just have a lot of mycotoxins from exposure. But either way, these are not only hijack our actual vagus nerve because they affect it in a negative way, but they affect our immune system, our inflammation, they slow down our detox, they mess up our minerals, and that goes for Lyme disease as well. Environmental toxins and chemicals. So we have thousands of different chemicals introduced in the last 20 years that didn't exist. So our DNA in our body has a lot to deal with right now. There's, a lot of waste, a lot of different chemicals in our body products, in our water. So we're just inundated with these things. But it shows you how powerful the human body is because, it is giving us signs that it's too much and we're having to learn ways to help it. But like our body is doing a lot for us. It's filtering a lot and it is pretty magical. EMFs and radiation. So electromagnetic frequencies have always been a problem. They've just been not a lot of light was shed on them because it wasn't as obvious because you can't really feel them all the time. Some people do have electro hypersensitivity or EHS, which is now being studied in places like even Women's College in Toronto. However, I think a lot of the times it's also missed that it's a huge problem. So since they rolled out something called 5G, and this is a direct wave or almost a microwave, it really is affecting humans in a negative way. And they did animal studies, which did not bode well for these animals, but they've never tested it on humans, but they rolled it out. So EMFs and different radiation is also something our body has to deal with. And when any of these things overload our body, we are going to get low vagal tone. Because when we have too much waste and it can't clear, not only can the vagus nerve be actually infected with certain bugs like Lyme and other viruses, but there's also the whole fact that the vagus nerve is most superficial on the front of the neck down. It goes down under the collarbone. And that's also where all of our drainage, like our sewage, our lymphatics get stuck under our collarbones. So we actually get an accumulation of waste here, and the waste can literally just sit over top of the vagus nerve. It's a big reason for thyroid issues. And if we're not clearing waste and it's sitting there on top of our thyroid and our vagus nerve, we're going to feel very stressed. So we teach a lot of clearing for those areas manually and with different creams that help move lymph or open it up, or castor oil, or an ingredient called GC MAF, which I'm going to go more into. And then the other things that add to our toxicity are trauma and different emotions. So trauma, small t, capital T, is still trauma, right? There's big traumas, which we know there's loss, there's sexual assault, there's breakups, there's physical trauma. That is all huge. So but then there's small traumas that can accumulate, and all of those can lead to low vagal tone. Inflammation in our diet, I mean, that just gets added to chemicals, but that creates more waste, like seed oils or things that oxidize in our body that maybe we shouldn't be eating at the high amount that we are, but they are cheaper and they are available, and we're not taught that they're unsafe. But we should be really looking at the quality of our food. So organic whenever that's possible, researching what the proper oils are to use at which temperatures, and just finding out what works for us. Genetics, we kind of touched on. I mean, environment turns on these bad genes. Like epigenetics is huge. Your genes, you can't change. You can change what they're bathed in. Postural or structural, I touched on this really briefly, but forward head posture, um, tight shoulder, anything that puts pressure on the vagus nerve can create lower vagal tone. So manual therapy is really important in structure and strengthening the right muscles and having balance in our nervous system. And then low grade chronic stress, just the accumulation, right? So anything that increases our toxic load and decreases, and therefore decreases our drainage. The drainage is getting the crap out, right? How do we drain? Through our liver, we poop it out. Breathing through our breath, sweating through our skin. A lot of these get blocked up, but then there's the mechanical stoppage that happens. There's the actual traffic jams of waste. And people are starting to feel it more. You can feel your lymph aching. Like this is one of your nodes here. So if you felt aching here, aching in here, a lot of people get these, why are my traps tight? I didn't do, well, it's waste accumulating. So anything that increases toxic load and decreases drainage will decrease your vagal tone. That will decrease your immune function and increase inflammation, since the vagus nerve is responsible for your immune system being nice and robust, and it decreases inflammation. And then there's that kind of negative feedback loop where you get more dysfunction, more disease, and more symptoms. This is just a photo of the actual foramen, or those little holes in our skull where all of our cranial nerves come out of. And I just put this up here to point out that in the jugular foramen where the vagus nerve exits, there's also something called the glossopharyngeal nerve that innervates part of the tongue. And there's the accessory nerve. So they share like a fascial sheath, they share an exit, and they also originate from very close on the brain stem. So your accessory nerve innervates your traps and some of your spinal muscles. And so people will notice those tight when their vagus nerve isn't functioning well. And that's one way that you can affect your vagus nerve, is by working on those muscles as well. So that's the part where manual therapy comes in. Also tongue posture, different sounds that we make with our tongue, even gargling, gagging, all can turn on the vagus nerve. So there's crosstalk with a few other cranial nerves, but it's all very interesting when you learn the anatomy of it. So what are some quick ways that you can support your vagus nerve? So deep breathing, but it's like a box breath with an extended exhale, because like I said, the exhale is what the vagus nerve is responsible for. So that extended exhale will turn on your vagus nerve. Humming, singing, chanting, we talked about how it's connected to the tongue. Gargling, gagging, cold exposure. So I get people to start with their face, or even an ice pack on their neck, and it helps them a lot, right? So doing a whole cold plunge can be too much for people that are in fight or flight too much, right? So you have to be careful with cold plunging. You have to work up to it. You have to work on breath. You have to work with a professional to do cold plunging. You can make things worse. You can trigger pleomorphic changes with that stress, which means you turn a bug that your body has kept at bay into a more active and pathogenic bug. So we want to stay away from things that stress our body too much acutely if we're not ready for it. Far gazing is a huge one, because there is a connection between the ocular motor nerve, the fascia, and the vagus nerve. So when you're in a state of fight or flight, or you can't sleep at night, or you need to just turn on your vagus nerve for whatever reason, you can gaze as far as you can to the right, hold for 15 to 30 seconds. You'll feel yourself relaxing. Or you're going to gaze to the left and hold it until you sigh or feel yourself calming down. Now, even if you can't sleep, you can do this with eyes closed. So your eyes are closed, but you're still gazing. And that can be really, really, really helpful for calming down. That's one of the ones that I highlighted because it works really well for me. Meditation. Obviously, we know being in the moment, living in the now, we're not going to be in fight or flight, but it is hard for a lot of us to get into that state. So, binaural beats. So these sounds are huge for calming our nervous system. So are turning on our vagus nerve. So you can Google or YouTube binaural beats or 528 hertz, but sounds are also very activating for our vagus nerve. Yawning, puffing out your cheeks, just changing your facial features, because there is a monotone facies, it's called, like when you're sick or when someone has fibromyalgia or any pain, like your face almost changes shape. It becomes like almost looking like paralyzed, like you don't have a lot of facial expressions. That happened to me as well. So if you can just change it temporarily, puffing out your cheeks or using your tongue to stretch your cheeks, smiling, even though, you can look funny, it can really help activate your vagus nerve. Acupuncture or pseudo acupuncture. So we use tapping with a toothpick. So you can tap inside your ear, kind of right where your earphones would sit on your ear, but in the center there's a point called Shen Men, and you can tap it with a toothpick if you can't get acupuncture, because that small surface area helps to move the chi. And it can be very calming, and you can do over your sternum. You can do where the vagus nerve is most superficial over the neck. The scalp is a huge one for sure. And in the hands, there's different points. So you want to tap different points for you. And we have some videos on this, and see what works the best for you. Massage, chiro, or visceral manipulation. Huge, huge. This helped me so much. Knowing what I know, having the colleagues that I had, my husband learning how to treat me, help me get over this fight or flight and activate that vagus nerve and get those organs, that blood flow that are innervated by the vagus nerve, and then the body goes into a rested state. Spending time in nature, we definitely don't do enough of that. Supporting circadian rhythm, that goes with nature, because we used to be very much more connected to the sunrise, sunset. We have all this artificial light over our heads. We're looking at screens when we should be winding down. There's blue light everywhere stimulating cortisol when it should be red light stimulating our melatonin. So, that is really supportive. Removing toxins. Finding someone to work with to find what your toxic load comprised of mostly, and then trying to be as specific as you can in removing those toxins. And it's not always as easy as it sounds to remove them, but once you start to get them moving out, you're going to feel much better. Okay. Red light. Red light's huge. It's giving energy to your mitochondria. Your mitochondria are what your vagus nerve uses to turn on. It's what your heart uses to pump. It's what makes energy for every cell. The more energy that organ needs, the more mitochondria per cell. So heart, brain, vagus nerve, gut, all lots of mitochondria per cell. Very powerful. The red light's going to help that. So it's going to help you make energy that you need to detox. And we respond to frequencies, we respond to light. So we have to start to recognize that that's part of the thing that makes our world toxic and start to protect ourselves. Pedal pumping. So I said that the sacrum, the nerves that come out of the sacrum, are the parasympathetic innervation for the lower part of our viscera or our organs. So you can flex your feet, so toes to your nose when you're feeling stressed, and that's calming. The opposite is when athletes jump on their toes to like hype themselves up. That turns on the sympathetic. So vibration is huge. We use vibration with like castor oil or other lymph moving products, and using these handheld vibrators to move our lymph around. But that actual vibration to the vagus nerve is very relaxing, even over our organs. Sacral rocking goes back also to that parasympathetic innervation at our lower spine. The oculocardiac research reflex, goes back to that big connection between the eyes and the heart. But if you put pressure, a small pound of pressure on your eyeballs, or just with the palm of your hands, it actually can lower your heart rate. And I had Lyme carditis, so I had a really high heart rate, and I would use this to try and bring it down. Tongue exercises, we talked about those. I got a tongue tie cut, and the way that it changed how I slept and how I was able to get into my vagal state, because my tongue would sit at the roof of my mouth. Tongue posture is important. And it helped. It was part of my healing process. Who or other vagal nerve stems. There's gamma core, there's now pulsetto, there's a lot. But they are just like something to give a little boost when you can't do it yourself. You're just zapping them into action. And then avoid holding your cell phone constantly, especially when it's charging. You're getting a lot of that bad, dirty electricity, that EMF, turning off your Wi-Fi at night, like just trying to ground, which means going onto the earth, actually having your feet on the ground, touching trees, gardening, all of that when the weather permits. Yeah, there are some grounding technologies. Some of them are great, but we're not going to go into all those. Different supplements that support your vagus nerve. So one of my favorites is GABA. So GABA is a relaxing neurotransmitter. It's the opposite of glutamate. It is more calming. And when you take GABA orally, it doesn't necessarily cross the blood-brain barrier, but it makes changes in the gut, right? It helps you regulate calcium, and lots of people's calcium goes awry when they have a high toxic load or when there's a lot of EMF. Or a lot of acidity in the body, which comes with waste. So GABA is very calming in multiple ways, but I've found that to be very beneficial. Parasym Plus helps for blood flow to the brain. It's specifically made to target the vagus nerve, and it can be very beneficial. Taurine is a very calming neurotransmitter. I mean, amino acid. It also helps the liver for detox. I mean, it supports the heart. It is a very, very beneficial amino acid. Phosphatidylcholine. Choline is the neurotransmitter, or acetylcholine is the neurotransmitter of the vagus nerve. So phosphatidylcholine, anything that can bring up your choline, is very supportive for the vagus nerve. PS stands for phosphatidylserine, another one that helps lower cortisol. Cortisol is one of our fight or flight neurotransmitters. So we want the opposite of that. And so we can shut down that cortisol so that we can turn on those more relaxing neurotransmitters. Magnesium L-threonate is a magnesium that can cross the blood-brain barrier, that can be very calming. 5-HTP works for some people. L-theanine I love as well. That's another neurotransmitter that's very calming. It's found in green tea, matcha, all of that. Melatonin is obviously a relaxing hormone or molecule. Very safe. There's some controversy, but I suggest you actually go into the studies because it's pretty magical. It's antiviral, it's immune modulating, it activates your vagus nerve. I mean, most of us are not making enough serotonin. Serotonin gets changed into melatonin. So serotonin is, when you take an SSRI or when you take 5-HTP, it's to increase the serotonin. All the serotonin at night when the sun goes down gets changed into melatonin, but this isn't happening a lot with people because not many people, some people are not making enough serotonin, their gut's unhealthy. There's a lot. Alpha GPC, which is another thing that supports the choline. Minerals are depleted in our soil. We use too many pesticides. We don't have that nice, strong probiotics in the soil anymore. So the soil gets fermented to make the magnesium and different minerals, and they're being depleted. So humic and fulvic are ones that we use a lot that have helped me a lot. They feed the good bacteria as well. Lactobacillus rhamnosus has been proven or shown in studies to help activate the vagus nerve and be very calming for the brain. Enzymes, digestive enzymes, TUDCA, anything that supports that liver drainage pathway is going to make the vagus nerve more active. And then zinc and omega-3s also have some studies on activating the vagus nerve. So we got 6 do-it-yourself steps to activate your vagus nerve. Massage behind your ear. I'm not going to do it too much because thumping your sternum, deep belly breathing with longer exhales. We talked about that. Gargling, humming, or singing. Gazing exercise. We talked about that. And then cold water for the face and then eventually body.